divisions, scientists, we find different things. For example, when people harvest someone through so many divisions, no wonder they have shorter telomeres that say that helps scientists to determine which of them are less viable and have less potential.
Hi, everybody, and welcome to the Kidney Coach YouTube channel. I am naturopathic practitioner Fiona Chin, co-founder of the Kidney Coach, Kidney Disease Solution, and Kyogenesis, which are our products. And I am joined today again by a very distinguished doctor, and that is Dr. Alex Grinberg. Alex, thank you again for joining us. So Dr. Grinberg is a very distinguished medical professional. He started his medical training when he was 16. So I call him a bit of a savant back in Moscow, and he completed 3 years of his PhD program in clinical immunology. He's got over 3 decades of experience in medicine. And I think what I really appreciate about Dr. Grinberg's knowledge is that he has got all of this amazing knowledge when it comes to the latest technologies coming out, biotech, and their advances in medicine, and then how to stack that along with things like longevity, peptide medicine, to really add to what Western medicine can offer us, and then really take that to the next level by really staying on the cutting edge. So he works in clinical practice, he works with patients. I'm sending him my very complicated cancer patients all the time because he's got such a good amount of knowledge around that, and all the, like I say, the latest technology that's coming out. So Dr. Grinberg, thank you again for joining us. I always appreciate your time, knowledge, and expertise. Is there anything else you wanted to add to that? I know you are really on the cutting edge. Let's come down to stem cell exhaustion. Talk to me about what that means and how that relates to chronic kidney disease and aging.
That's a beautiful term, stem cells exhaustion. And but
it's very bright. They're exhausted.
But it does happen, and it happens with a different rate for different lines of stem cells, and also depends on probably everything that we earlier discussed today. And it's interesting working with cell medicine and asking these questions. Scientists, we find different things. For example, when people harvest someone's bone marrow stem cells, if the person, like say, middle age, these stem cells may be pretty exhausted. And what does it mean in the scientific term, stem cell exhaustion? It also means shorter telomeres.
Yeah.
Obviously, when you get stem cell treatment, you want, let's say you proliferated your own stem cells and you want to transfuse them. Obviously, you want repopulate your body with a telomere length that at least the same as other cells in your body, but preferably a little longer. So what happens if someone is middle age? The bone marrow has hematopoietic stem cells. These stem cells are precursors of all other blood cells, and we know that blood cells have relatively short lifespan, like from a few weeks to a few months.
Yeah.
For this reason, these hematopoietic stem cells have to be in very frequent division to maintain the population, of the cells they eventually differentiate to. That means circulating blood cells. So going through so many divisions, no wonder they have shorter telomeres that say stem cells from the fat tissue, where usually, even if people do intermediate fasting, the cells there divide very rarely, and only if people had extreme fasting and extreme changes in their weight, they divide by the age of 50 or 60, maybe only a few times. So, and research shows that they have much longer telomeres than hematopoietic stem cells and many other cells, and for this reason they're good for retransfusion, and autologous fat tissue derived stem cells seem to be good means and safe means of cell therapy. But there are also other markers of stem cell exhaustion. The CD receptors on their surface probably undergo a certain dynamic where that helps scientists to determine which of them are less viable and have less potential to turn into something useful and regenerative in the human body.
Mm-hmm.
And definitely all the factors that we mentioned, like diabetes and related protein glycosylation, affect how stem cells maintain their health and avoid exhaustion. Mitochondrial dysfunction, definitely stem cells need strong and functional mitochondria. Overall, telomere lengths and factors that affect telomere lengths. Of course, stem cells are also part of the body. They're not immune to attacks and assaults on the body we get from either bad lifestyle habits or radiation, etc. They all suffer the same damage that manifests as stem cell exhaustion or even decrease of their population. As everyone has different amount of stem cells, let's say per 1 cc of his or her blood. That's also to understand. So, and of course, nutrient dysfunction, deficiencies, and inflammation, and inflammation actually that we'll discuss next is very chronic inflammation and related cascades of physiological reactions are very important, and they are not friendly and not supportive of having healthy stem cells.
No, they are certainly not. And with stem cell exhaustion, obviously, I mean, if we look at this diagram, we can see that, as we mentioned, epigenetic factors, telomere erosion, DNA damage, mitochondrial dysfunction leads to senescence. Senescence leads to nutrient dysfunction, proteostatic dysfunction, and they feed back into senescence. And then senescence will lead to stem cell exhaustion and chronic inflammation. So all of these things are super important to make sure that our stem cells aren't exhausting. And you mentioned intermittent fasting. That's something that I've seen that makes a big difference when it comes to stem cell health and things like that. But is there anything else, apart from obviously working on these top areas, is there anything else that you've noticed will make a big difference with stem cell health?
Yes, and also talking about senescence, obviously the higher burden of senescent or mutated cells in the body affects it's kind of interference with normal function of bone marrow. It produces a lot of endotoxins and also kind of distracts, in simple terms, it distracts resources of the body on dealing with senescent cells versus maintaining and supporting its stem cell population.
Yeah, senescence is such a, it's funny, like in Australia, it's not something a lot of people are talking about. I'm doing a big lecture tomorrow on it when it comes to diseases and aging, and senescence, we now know plays such a major role. Just the whole fact that you can take senescent cells out of an aged rat, inject it into a young rat, and that rat will get exactly the same diseases of aging within a week as the old rat. So, that senescent zombie cells sort of thing. So that big load of senescent cells, I think, is a big key factor to reducing a lot of these chronic diseases and slowing down aging and helping with longevity. And of course, these things feed into that. And then if we can improve senescence load, we're going to improve these bottom 4 areas, as you spoke about.
So a few words on this. So a few simple advices, like some oriental medicine plant-derived icariin supplement is improving production of your own stem cells. There are certain algae marine products that help to improve production of stem cells. Hyperbaric procedures improve stem cell production. And actually, I'm asking scientists that I'm working with to do simple assays where we measure how we can affect stem cell exhaustion and their functions and the receptors, incubating them with certain peptides or subjecting them to certain physical conditions, so to see what affects them and how we can measure it and direct it.
And thank you for your expertise. If anyone wants to contact Dr. Grinberg and work with him one-on-one, whether it be kidney disease, especially integrating peptide medicine into your regime. I know I've used him personally for that. I'll put Dr. Grinberg's details below. He works out of San Francisco and is available to do telehealth and Skype consults with people all around the country. So, and as well in different countries, because he's working with some of my cancer patients. So again, Dr. Grinberg, thank you so much for your knowledge and expertise. It is always a privilege and an honor to have someone as esteemed as you on our channel sharing your wealth of information. If you want to know more about what we do, head to www.kidneycoach.com. You'll find us on Instagram and Facebook under the same name. Remember to hit subscribe and like. That way you will be notified anytime we put up new videos. And if there's any topic that you want Dr. Grinberg to talk about, or if you have any questions about this podcast, please put them in the notes below and we will be sure to answer them. Thanks again for being part of our community. Dr. Grinberg, thank you again for your time, and I look forward to seeing you all next time. Bye.